All right, let's jump right into this explainer. Today, we're decoding the human eye as a highly complex organic machine, and then we're stepping directly into the surgical workshop to see exactly how medical professionals fix it. We're drawing from some fantastic source material that breaks down both the incredibly intricate anatomy of our vision and the fascinating, almost mechanical procedures used to repair it when things go wrong.
We've basically split this journey into two main chunks. First up, we'll map out the anatomical blueprint and the eye's defense systems. Then, we'll step straight into the workshop for the mechanical repairs. Everything from fixing the plumbing to realigning the optics, and even some pretty extreme inner surgeries. So let's kick things off with Section 1, the blueprint of the eye, and mapping this organic machine.
To figure out how to fix this machine, we've got to understand its core parts. And look, medical naming conventions can be, well, intensely dense. Take the spaces inside the eye, for example. The front part is called the anterior cavity. But here's the kicker. It actually contains both an anterior and a posterior chamber. Then, sitting behind the lens, you have the vitreous chamber, which is also known as the posterior cavity. Yeah, as our source material perfectly points out with a bit of dry humor, I know, not confusing at all. Sarcasm. I mean, seriously, having a posterior chamber inside an anterior cavity, it's enough to make your head spin. But stick with me here, because grasping this layout is absolutely crucial for the repairs we're going to look at later. This layout brilliantly highlights the difference in the fluids running through the eye. That anterior cavity in the front, it's filled with aqueous humor, which is a thin, watery liquid. Meanwhile, that massive posterior cavity in the back is packed with vitreous humor, a thick, jelly-like substance that physically gives the eyeball its shape. Basically, think of it as watery plumbing in the front and structural, supportive jelly in the back. Moving right along to Section 2, tears and the defense system, the two-part shield. When we look at the eye's built-in environmental defense system, the biggest takeaway is that tears aren't just salt water. They're actually a two-part moisture shield. See, the lacrimal gland, up in the outer top corner of your eyelid, produces the watery stuff we normally call tears to wash the eye. But lining the edges of your eyelids are the meibomian glands. They pump out an oily substance that coats the water. That oil literally acts like a lid to stop the water from evaporating, keeping your eye perfectly lubricated. Which brings up a really fun question. Why exactly does your nose run when you cry? Well, the answer is all about the nasolacrimal duct. After tears wash over your eye, they pool in the inner corner and drain down ducts that wire directly into your nasal cavity. It is literally drainage plumbing connecting your eyes straight to your nose. So when you cry, that plumbing just completely overflows, and bam, your nose starts running. Now that we've got the blueprint down, let's step into the workshop in Section 3, eyelid and plumbing repairs, getting under the hood. Just like any mechanical comp, those oil-secreting meibomian glands along your eyelashes can get backed up. When they clog, the duct gets inflamed and balloons into a lesion you probably know as a sty. To fix it, doctors do what's called Chalazion surgery. It's this highly precise surgical cleanout where they remove the sty and get that vital protective oil flowing freely again. But what if the main drainage plumbing completely fails? If that lacrimal duct gets totally blocked, your tears literally have nowhere to go and just constantly spill down your face. The fix here is wild. Surgeons perform a dacryocysto-rhinostomy, or DCR for short. They snake a tiny endoscope and a burr through the nose and literally drill a brand new bypass hole straight through the bone to reconnect the tear duct to the nasal cavity. We're talking structural engineering on a micro level here. That brings us to Section 4, relieving high eye pressure and unclogging the inner system. Going deeper into the inner plumbing, we run into one of the most dangerous pressure issues out there, glaucoma. This is effectively a catastrophic backup of that watery fluid in the front of the eye. Because the eye is a closed container, if that aqueous humor can't drain, the pressure skyrockets. That front pressure pushes the lens backwards, which presses into the jelly-like vitreous humor, which ultimately crushes the optic nerve at the very back. And if left unchecked, crushing those sensory cables means permanent blindness. Scary stuff. So how do the mechanics fix this? Well, sometimes the iris and the lens are just pinched too close together, blocking the fluid. Enter the iridectomy. Surgeons essentially install a pressure release valve. In the past, they used scissors, yikes, but today they just fire a highly precise laser to punch a microscopic hole straight through the iris. Boom. Aqueous flow is instantly restored and the pressure drops. Alternatively, The actual drainage grate itself, the trabecular meshwork, might get clogged. If the fluid can't exit back into the bloodstream, surgeons perform a trabeculectomy to bypass the drain entirely. They'll cut a tiny hole through the white part of the eye, the sclera, and let the fluid drain into a brand new surgically created pocket called a bleb just under the outer tissue. Sometimes they even install a microscopic mechanical shunt valve to physically pump the fluid out. It's pretty amazing. All right, Section 5, Fixing Focus and Alignment, Calibrating the Optics. To physically calibrate where our eyes are looking, we have to talk about how the eyeball is actually piloted. It is controlled by extraocular muscles hiding behind the eyelids that act exactly like pulley cables. You've got the superior on top, inferior on the bottom, lateral on the outside, and medial on the inside. If these cables pull unevenly, the eyes fall out of alignment, a condition called strabismus. To fix this, doctors physically detach the muscle, trim a bit off to shorten the cable, and suture it right back onto the eyeball to pull everything perfectly into center. And what about fixing the camera lens itself? Over time, that internal lens can get cloudy, which is what we call a cataract. The fix for this is honestly jaw-dropping. Surgeons insert a tiny tool called a phacoemulsifier. It uses rapid ultrasound vibrations to literally shatter and liquefy the cloudy lens. Then they vacuum out the fragments, take a brand new, rolled-up artificial lens, slide it through the incision, and unfold it perfectly into place. Just incredible. Now, if the outer windshield of the eye, the clear cornea, gets severely scratched or damaged, they'll do a keratoplasty, which is a full transplant. They use a circular instrument called a trephine blade. It works exactly like a surgical cookie cutter, spinning to make a flawless circular cut to remove the damaged tissue. Then a perfectly clear donor cornea is dropped into that exact spot and tied down with incredibly fine radial sutures that looked kind of like the spokes on a bicycle wheel. Finally, we arrive at Section 6, Extreme Inner Eye Surgeries, the Deep Fixes. For this final workshop phase, we are going deep into the back of the eye for the most extreme structural interventions. If the retina, that crucial cellular wallpaper processing light at the back of your eye, starts to peel away, it is a massive emergency. To fix a detached retina, surgeons do a vitrectomy. They literally suction out all of that thick, jelly-like vitreous humor we talked about earlier. Then, to press the peeling retina back against the wall, they inflate the eyeball from the inside using gas, saline, or even silicone oil. Once the retina is forced flat, they use a laser to weld the tear completely shut. In worst-case scenarios involving severe trauma or disease, parts of the eye or even the whole thing have to be removed. Medical terminology gives us 3 very similar-sounding procedures for this that actually mean vastly different things. Evisceration removes only the inner contents of the eyeball, leaving the white sclera intact. Enucleation removes the entire eyeball, sclera included, but leaves the outer muscles behind. And exenteration removes the eyeball, the muscles, and all the surrounding tissues inside the eye socket. To keep all that straight, our source material provides some absolutely fantastic mnemonic devices. Evisceration sounds like viscera, which means your internal organs or the inside stuff. Enucleation contains the word nucleus, representing the whole round core or the eyeball itself. And exenteration sounds like extend, because the surgery literally extends beyond the eye into the surrounding tissue. It just goes to show a little word association goes a long, long way in medical science. Ultimately, what you should take away from this explainer is a profound newfound appreciation for your own vision. The anatomy of the human eye is nothing short of miraculous. It's this perfectly balanced machine of optics, pressure, and fluid dynamics. But equally awe-inspiring is the sheer mechanical genius required to rebuild it when things go wrong. From drilling drainage pipes through solid bone, to shattering lenses with ultrasound, to laser welding a retina back into place, the structural ingenuity we use to save our sight is simply mind-blowing. So, how much more do you appreciate this unbelievable organic machinery every time you blink?